Welcome to the deep dive. You know, you walk into any grocery store today and it's just this wall of gluten-free products. It feels like there's a global epidemic of gluten sensitivity. The scientific name is non-celiac gluten sensitivity, or NCGS. But what's the real story here? Today, our mission is to do a deep dive into some of the highest level research we have. We're talking systematic reviews from the BMJ and the Lancet from 2025 to get past the marketing and find the actual science.
And that kind of critical thinking is so important here. Because what's fascinating is how tangled up this whole debate is with, well, huge financial incentives. There's this gluten fear that's been created.
Gluten fear, right.
And that fear, really more than the medical evidence, is what makes that gluten-free market so incredibly profitable.
Okay, so let's start by unpacking some of that fear. I mean, the sources point to some really extreme, unproven claims that have fueled all this public anxiety.
Oh, absolutely.
Like the claim that gluten causes osteoporosis. I mean, you just stop and think for a second that wheat is a staple food for billions of people. It just doesn't add up.
It doesn't. And the sources bring up others like the idea that going gluten-free improves infertility or solves low birth rates. It's actually scientifically backward.
How so?
Well, these kinds of really restrictive diets, when they're not necessary, can lead to nutritional deficiencies. And those deficiencies can actually make it harder to conceive, not easier.
Right.
Then there's the one about gluten and low-fat diets causing gallstones. Again, completely unsupported. These kinds of claims show exactly why we need to rely on systematic reviews and, medical guidelines, not just individual anecdotes.
So let's pivot to the core data from those 2025 reviews, because the numbers really show this huge misunderstanding. Globally, about 10% of people self-report symptoms they connect to gluten.
Right, they think it's gluten. And they don't have celiac disease or a wheat allergy.
And self-diagnosis is just rampant. It's up to a third of people in some high-income countries.
And this is where we see this huge gap between perception and what's happening physiologically. Because when researchers do controlled studies, these are blinded challenges where you don't know if you're getting gluten or a placebo.
Yeah.
The results are, well, they're shocking.
What do they find?
Only about 16 to 30% of that group who self-diagnosed actually have symptoms that are specifically triggered by gluten.
That is a startlingly small number. But okay, hold on. The symptoms people feel, the bloating, the discomfort, those are real. People are genuinely suffering. So what's actually happening?
That's the critical question. And the research shows a massive overlap with other conditions, especially irritable bowel syndrome or IBS. We also see strong links to psychological factors like anxiety and depression. The problem is there's no clear biomarker for NCGS, which makes it really hard to diagnose.
So expectation plays a role.
A huge role. It's what we call the nocebo effect. It's kind of the dark mirror of the placebo effect. If you expect something to harm you, your body can actually create real physical symptoms like pain or bloating just from that suggestion and stress.
So if it's not gluten for the vast majority of these people, what is the biological driver? What's the real culprit?
The leading hypothesis, and it's a very strong one, points to something else in wheat called FODMAPs.
FODMP.
Yeah, it's an acronym. It stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. But you can just think of them as short-chain carbohydrates.
And what do they do?
Your small intestine doesn't absorb them very well, so they travel down to your large intestine where your gut bacteria just have a feast. They ferment them very rapidly, and that process creates a lot of gas and pulls water into the gut.
And that causes the bloating and cramping people blame on gluten.
Exactly. It's that fermentation process causing the symptoms in many, many cases.
So what does this all mean for you, the listener, if you suspect you have a sensitivity? The JAMA coverage of this research had a really crucial warning.
I think I know what you're going to say.
It's that you should not just decide to go on a gluten-free diet on your own. You really should be talking to a nutritionist or a gastroenterologist first. The financial cost, the psychological burden, and the real risk of nutritional deficiencies, things like fiber, iron, B vitamins, it's just too high a price to pay when the problem is likely FODM use, not gluten. So this deep dive really shows that the prevalence of true non-celiac gluten sensitivity is just severely overestimated. It's driven by self-reporting, powerful marketing, and real reactions to things like FODOPs. And it leaves you with a final thought, doesn't it? If commercial and media influence can so powerfully reshape our perception of a basic food like wheat, what other deeply held food myths, based on marketing instead of science, might be influencing your health and your choices right now? Something to mull over.